So thank you all for having me here today. It's an honor to be among such creative minds. So without further ado, I'm here to talk about a really exciting project that the Oral Pathology Diagnostic Sciences team at the University of Michigan School of Dentistry and I have worked really hard to come together. So I'm a third-year dental student at the University of Michigan, and before that I went to Albion College, where I always knew I wanted to be a dentist, and I don't know if you all are familiar with Albion, it's about an hour away, really small school, but definitely got me where I want to go, and I'm no regrets, I'm happy to be here today. So here's our Educational Diagnostic Sciences team. You may recognize a few faces. Dr. Theodore Donchu, who is here today, our oral pathologist, Dr. Erica Benavides, Dr. Brandon Viramis, our oral pathology resident, Clayton Fisher, Dr. Vidya Ramaswamy, and our very own Daniel Kiskis. So a little bit about the dental school curriculum. Oral pathology is incorporated really early on as a first-year dental student, and we go through about 4 or 5 courses by the time you're a third-year student. And there's an immense amount of information that you're learning over a short period of time, a lot of memorization, hundreds and hundreds of different diagnoses. So I don't know how familiar you are with diagnostic sciences and oral pathology, but it's essentially the study of oral and maxillofacial manifestations. So any sort of diseases or certain clinical scenarios that can affect the oral and maxillofacial region. So it's important for us to gain a lot of skills through these courses, and unfortunately sometimes just through memorization we can't always put those skills to practical use. So a little bit of what we learn is not only recognizing certain clinical manifestations, but also learning how to go about diagnosing and kind of what clinical decision-making skills we have to learn in order to best treat our patients. So a little bit of how we got to this Case of the Month project, just to give you a little bit of an overview. I came to the dental school as a first year and had a really great opportunity to work with also a fellow Albion alumni, Dr. Brandon Viramis, who was working on a database project at the time funded by CRLT. And this database project was essentially a new resource open to the dental school at the time, having tons of clinical cases, including histology images, before and after treatment clinical images, and descriptions of all of these manifestations. So I was lucky enough to join on board with him and take a lot of histology images, and I soon learned how invaluable these types of skills would be no matter what career I chose in the dental field. So, even if you don't want to become an oral pathologist, these are diagnostic skills that really will suit your patients well and will make you a better overall clinician. So essentially that's how we came to this Case of the Month project. So after the database was finished, we wanted to see how else we can enhance the learning of diagnostic sciences to students, and how students not only, we're getting really good at taking multiple choice questions, but how can we put all of this to practical use? And in essence, once we get up to the clinic as a third-year student, you're not seeing these every day. You may never come across something you've learned in oral pathology while you're in your last 2 years of dental school. So to be able to reinforce all this information and allow yourself to test yourself, we thought that a Case of the Month learning module would be the way to go. So what is Case of the Month? Case of the Month is an online learning module that essentially presents every month a new oral pathology case. And these cases come through the oral pathology biopsy service at the dental school. And essentially what we do is we present first the patient how they presented to whether it was their primary dentist or specialist, and then we allow the student or viewer to make a preliminary diagnosis. So the idea behind this Case of the Month isn't just to provide a case report, but it's supposed to be an interactive interface where students can start to exercise these skills that they've built over their first 2-3 years in the dental school curriculum. So our target audience right now is mostly dental students, residents, faculty, and alumni. This Case of the Month project is only open to the dental school at this time, but we do have hopes that in the future, once we've collected more data and kind of received more feedback, where we can take this and what kind of interfaces we can use. So what we're using right now is actually CTools. I'm sure all of you are familiar with. Dan Kiskis actually worked intimately with us on this, and we decided that CTools was the best route to go at this time just because of its user friendliness. Everyone in the dental school is using CTools right now. We have school-wide access. We can incorporate it into mini courses. It does have an interactive component, so it allows us to have questions in between certain pages. And then also we can track data pretty easily. So we can track who's using it, how long they're there for, as well as how they're doing on these diagnostics questions. So like I said, it's not open to the public community at this time, but we do have hopes for that in the future. So I'd just like to kind of go through what the learning module does look like. These are all just screenshots, so I hope you can read a little bit, but if not, essentially this is what the home page looks like. And students and faculty of the school, they receive a monthly email that is school-wide notifying them that a new case has been posted. So when they get to the home page through that link of the email, they'll come here and they're given instructions on what to click to get to the next case. So essentially first there's an identifier question, so we want to know who's looking at this case. Is it a first year, second year dental student, third year, fourth year dental student, a faculty, a resident, dental hygiene student? We like to know, essentially we didn't know who our target audience was going to be, so this has been really helpful for us. Before we start the case, we have a pre-case question, so we do hope that those who are viewing have somewhat of a background and are able to kind of navigate their way through this first question. It's usually a very detailed question, so here it's asking you which group of lesions should be included in the differential diagnosis of a well-defined interradicular radiolucent lesion associated with vital teeth. So there are certain buzzwords in that question that should be triggering all of these students, to start thinking about certain diagnoses. Just hearing the word vital teeth, we're trying to train ourselves to go from something really general and kind of have our own flow chart in our brain of how we can narrow down our diagnoses. So our hope is that they're answering this first question, maybe not having all the information, going through the case, and then they'll answer this question again, hoping that if they haven't answered it right, essentially in the beginning, they will after they've gone through the case. So this is a screenshot of what the patient presentation would be, just giving how the patient presented to their dentist. Usually we try to include the words directly from the dentist, how they first saw the lesion, how they described it, things like that. And sometimes the patient will have contributory medical history. We'll include any clues that can really help us narrow down our diagnosis here. We'll also include radiographic findings. This is a very important tool in diagnostic sciences that we use and can also help with our differential diagnoses here. So another component we include is the histology. And we understand that students go through oral pathology courses and try to memorize how different cells should look like and how all of these slides should look, and we're never capable of remembering all of this if we're not reinforcing it. So a lot of these things here are really just to help incorporate the big picture, but we do understand that sometimes a student may not understand what they're looking at if they're just looking at a histology slide here alone. So after giving all of that information, we allow the viewer to make a diagnosis. So we haven't really told them what the diagnosis is at this point in time. And then we'll go into a kind of like a discussion and we'll provide a table. So differential diagnosis is something that is really important to form when you're looking at these lesions and making a diagnosis. We want you to kind of be able to make a list of 3 or 4 lesions that this could possibly be. And in your mind kind of form a pros and cons for why this could be or why this couldn't be, based on the clinical presentation, the x-rays that are provided, and et cetera. So actually, going back to this patient presented to his periodontist with this swelling in his lower mandible and just a 3-month duration. So this patient actually ended up losing the 3/4 of his mandible, actually. So this was a really good case that we were excited to kind of put out there, just because it just shows the severity of what can happen if we're not competent in our diagnoses. So not to say that anything went wrong here when the patient was managed, but there are a lot of clinical manifestations that are scary, and it is our responsibility as dental professionals, regardless of what career you go into in the field, to at least recognize when something doesn't look right and what to do about it. You know, this patient shouldn't be followed up 6 months from now, because in 6 months, something like this that's a benign tumor but locally aggressive can expand over a short period of time. So this was a really good case example just to demonstrate the importance of building these skills and understanding the importance of them. So then afterwards, we provide about 3 to 4 CE-like questions, so questions that will follow the case, usually information that's been provided in the case. Viewers do have the opportunity to go back and read a little bit, but once they have answered the question, they can't change their answer. So we're also looking at how people are responding to these questions as well. So 2 weeks ago, actually, we held our first seminar. So a part of this project, we had the goal of holding seminars for every 4 cases that were presented. And in these seminars, we would actually represent the past 4 cases that were on the CTools site through different presenters, one being myself, Dr. Theodore Donchu, whoever was kind of involved with the case. And this just allows students and faculty to come and kind of have the opportunity to ask questions about the cases, hear it maybe in a different form than an online learning module. And we also provided a survey at this time. So the surveys, we were hoping to give us a little bit of information of how this online learning module is working. So at this point in time, there were only 4 cases that were provided, and we just kind of want to know if this is something worth our while, if it's something we want to continue. So a little bit of data that I just want to discuss with you guys. This is the user distribution so far with the past 4 cases. So as you can see here, predominantly we are having viewers of like the D3, D4 class, 3rd and 4th year dental students. And this kind of makes sense just because at this point in time, most of the information provided isn't out of the scope of a 3rd or 4th year dental student as opposed to a 1st or 2nd year. But we do hope that our cases still can be well interpreted by a 1st and 2nd year dental student, especially after working through the whole case. So this shows us a little bit about who's visiting these sites and how many are visiting. So the teal blue column is how many people are actually clicking on the link once they receive their monthly email. The yellow column is showing how many people have started the online learning module for that month, and the dark blue is who has finished it. So you can see that there's a drastic difference between who's clicking on the link and who's actually finishing the online learning module. So that's kind of one concern we have, is why people aren't completing the exercises. So that's something we want to kind of work out, and at any point in time, if you guys have any comments or questions, feel free. But this is something that we'd like to see more higher numbers. We'd like to see 80 to 90% who are clicking on the link to actually complete the case. So another thing I want to point out is October, you can see there's a lot higher numbers. And this was a month where the 3rd year Diagnostic Sciences course had their midterm. And a lot of these students are thinking, oh, well, let me try to get through this case. Maybe the questions are going to be similar to the online exam. We know Dr. Donchu is part of this project, and she's the one giving our exam. So we know that there's a lot of forces behind why people want to get onto these learning modules. And sometimes, we have to put incentive into students in order to complete them. So that kind of gave us an indication that we do have a little bit of work to do as far as incentive goes, and just promotion of the project in general. So here's actually a cumulative of all the 4 months. So total visitors compared to total case completions here. You can see more than half are not even completing the case at this time. But we still do have decent numbers, so we're happy to see that, but hope for improvement. So these were a few of the questions that were given in that survey that was distributed at the seminar. Just kind of asking how people are feeling that these cases are contributing to their education. Is it reinforcing course material? Is it reinforcing your ability in the clinic? Do you find that this is an excellent resource? Questions of that nature. So as far as the first question, does this online learning module increase my ability and confidence to evaluate patients? So here the grading was out of 5, 1 being strongly disagree to 5 strongly agree, and I kind of just gave an average here for what kind of responses we had to these surveys. So the second being, does this online learning module clarify key concepts in diagnostic sciences, including pathology and radiology? Third question, integrating and applying material presented in diagnostic sciences courses. Fourth question, asking if this is integrating and applying material in general to the School of Dentistry courses. The fifth is, are these CE-like questions, or the questions after the case, helpful in reinforcing concepts presented in the case reports? And sixth was asking, is this an excellent resource to you? So in general, we were pretty happy with the feedback, and there were 92 viewers, including faculty and students, who filled out this survey. So as far as future progress, we do have a lot of exciting things that have happened so far, and a lot of things we're hoping to improve. One being we would like to increase awareness of Case of the Month. There are still people who get these school-wide emails and just don't open them. So that's a concern. We would like to also be able to stress how much this type of exercise can reinforce and apply a lot of the knowledge that students are getting from their dental curriculum. And we'd also like to increase incentive. So we're brainstorming a few different ways on how we can do that, but we also don't want to have too strong of a force behind it. We want people to use it because they find it useful. There's data also we'd like to still look at. How long are people on these learning modules? Are they repeat customers? Are they visiting each month more than once? And then also we'd like to improve access. So in the future, we know that this is going to be a great resource, but we first of all would like to work out a lot of its kinks. And then secondly, eventually allow alumni, just the dental community in general, to be able to access this. Because as we know, as dentists progress through their career, it's harder and harder to retain a lot of information if you're not reinforcing it. So those are our goals right now, and that's all I have for you today.
Questions for Renee?
I was wondering if you had thought about engaging with alumni by creating these, actually, not just having them come and consume this Case of the Month, but also many of them are out there practicing, hygienists, dentists, whatever, and may be very interested in that kind of professional development aspect, and in supporting and kind of reconnecting with the alma mater by providing more cases and working with you to create them. Have you thought about that at all?
Definitely. So I apologize for not mentioning this earlier. So all of the cases that become good candidates for a project like this have to be well documented, one. So a lot of good images, good patient management, patient follow-up. But secondly, we would like to see the cases coming to the oral pathology biopsy service at the dental school. So that is a criteria that kind of does limit. We do, on the other hand, have a lot of cases to work with. But all of these cases coming to the oral pathology biopsy service are from surrounding dentists of the community, periodontists, general dentists, oral surgeons. So in that way, we are engaging a lot of community dentists, including, I'm sure, alumni, but the awareness isn't there yet. So being able to spread that kind of exciting the dental community, I think, would definitely be something that we could benefit from.
Yeah, there's an underlying thing happening here too. I'm the director of the service, and we're trying to promote the service. So we're in a way rewarding our top contributors or people that document their cases very well by putting these up. You know, there's name recognition, there is practice recognition,
right.
And also we want to show the students that once they get out, they can have the same thing.
Yeah.
The other thing is the Journal of the Michigan Dental Association picked these cases up for publications in their monthly journal. So a lot of recognition for our contributors and everything else. So. But you know, these are things that we're working on, and I have to say that none of this would have been possible without the CRLT grant. So we're very grateful for that.
I really love this idea of monthly challenges, right? And two things that are great about it is it's outside of classes completely, right? It's just a thing, right? And it's meant for everyone to participate in it, faculty, first-year students, the whole thing. So I think it's just a really interesting model for another kind of learning challenge. And you can imagine building into it, I don't know, recognition for doing the best job of answering this. I mean, the way you've got it set up is a little bit, you know, the multiple choice kind of answers and stuff, so it's a little hard to do that. But if we had a Netflix data challenge every month, and somebody wins it, and they get a trophy, and maybe even a badge. But I had a little trophy for your shelf, you know, people could get excited about that.
And students would really use that for their CV,
Well,
you know, it's a big deal.
Yeah.
It's interesting because that builds incentive and courage to go into these types of learning modules, but we also like to keep it anonymous. So once students feel like they're being graded on something, it's a lot harder to get them actually to participate. So it's a slippery slope when it comes to something like that.
I understand.
And I
But
think that's the
definitely
reason the faculty is not participating, because they
Yeah,
know
yeah.
we are monitoring.
They don't want
So, I was thinking
Yeah,
about
they
that.
don't
They
want
all
to.
go in, but they don't
They never finish it,
answer
so
the
go to
cases, yeah.
So Renee, are the past cases available for participants to go back into and review?
Yes, so after the 1 month has expired, they no longer can make the diagnoses, but they can go back and review as many times as they like. So we're trying to cut off how, when they can continuously respond to the questions, just so that the data doesn't get thrown off. But other than that, it's a resource that they can refer back to. We've heard great feedback from even fourth-year dental students studying for their boards. It's just a great learning tool that's free and easy to access and comprehensive. So.
And how many people came to the follow-up seminar?
Regarding the questions, I had a number of 92. We had probably a little bit more than that, some just that didn't get the survey. I mean,
Over 100, I would say 120
Wow.
maybe. Yeah, but I'm giving them, so I'm the course director of 2 major courses, one in the fall and one in the spring.
Right.
So it's all this, I'm a top grader, so I give difficult exams, so they all come. Whatever resource I put out, they do it.
Right.
So.
Any additional questions for the team? Well, let's thank both of our speakers.